Oklahoma has been a top 10 state in the percentage of people receiving COVID-19 vaccines. But with people snowbound this week, that was bound to change. How much? And what other ways has this historically cold weather impacted the vaccination program? Rory Taylor continues our team coverage.
Oklahoma administered over 126,000 doses of COVID-19 vaccine last week. This week, less than half that. Just 60,000 doses is the freeze-inhibited vaccine distribution.
Our team is working incredibly hard to avoid any significant vaccine waste. Our team prepared in advance for the challenges the weather might bring, and we have several procedures in place to manage our doses. We have temperature monitoring systems and backup generators in most facilities, housing vaccine across the state.
While vaccine waste was avoided, the canceling of distribution clinics and delay of delivery has been significant.
Our overall vaccine supply has not been impacted by the weather, but the timeline for receipt and distribution has been affected. We were expecting vaccine allocations of approximately 110,000 doses for this week. Those doses would normally arrive during the first 2 to 3 days of the week. However, with weather obstacles, we have not yet received that vaccine.
The rest of those doses will be delivered this weekend. The state still has doses available for distribution clinics, though, after many from last week were postponed. The Tulsa Health Department pushed their pods starting last Wednesday into next week. They're now actively reaching out to people whose appointments were postponed. Oklahoma City is responding in a similar fashion.
For Oklahoma City County Health Department, we've rescheduled probably more than 2,000 appointments, and we pushed those back a week. And so as we've encouraged people who were concerned about the weather, that might be canceling their appointment, we told them, no, if you stick it out, we will reschedule the whole thing.
To cover lost ground, vaccine distribution is expected to boom as roughly 2 weeks' shipments of vaccine arrive close together. Even more so as the federal government ramps up the supply of vaccine being shipped to Oklahoma.
We're increasing the vaccine supply to 13.5 million doses per week that will go out to states. This is a 57% increase from the amount states received when the president was inaugurated. So since then, obviously, we have announced a couple of increases over the course of time. We're also announcing that we're doubling the supply to our pharmacy program.
This coming just in time for Oklahoma to expand distribution.
We're expecting to receive an additional 25% of supply from Pfizer as we begin vaccinating teachers and adults with comorbidities next week. This will make for a total anticipated 137,000 doses next week. This includes both Pfizer and Moderna vaccine and accounts for both prime and boost doses. And if you look at our numbers over this past week, we've not been able to burn through the vaccine like we want to. However, I really am not worried about our ability to catch up with that within the next week, 2 weeks at most. Probably, I think you'll find most of that happening within the next week.
Another concern the state is working hard to address: equity. The State Department of Health has added new Spanish language options to their portal, and Oklahoma City is working with local schools and even radio stations to reach out across language barriers.
We had a great pod scheduled for last Saturday down at Grant High School, and we had worked with the Guatemala consulate and the Mexican consulate to help with outreach on that side. And we had a couple other partners that we were working with to help with outreach, one of the Spanish radio stations, and then a fourth partner.
The pod has been pushed back to February 22nd, but registration for the event suggests many people are still hesitant to receive the vaccine.
We still know that we need to spend a lot more time emphasizing the safety of the vaccine. So we've recorded a message last week with the consulate of Peru, Mexico, and Guatemala they all came into our office and talked about the safety of the vaccine, and then we're going to do some more messaging in regards to that.
Those messages should begin circulating online and on radio next week. Rory Taylor, The Oklahoma News Report.